A stroke occurs when there is a sudden loss of blood supply to a part of the brain. This can be caused by a burst blood vessel, a hemorrhage, or a blocked blood vessel, an ischemic stroke. How the stroke survivor is affected will depend on which part of the brain is damaged by the stroke. This film will talk about functional independence after a stroke. A stroke can affect someone in many ways: movement, sensation, vision, thinking, concentration, remembering, talking and understanding can all be affected. These impairments affect what someone can or cannot do. The stroke survivor may have difficulties participating in activities in the same way as they did before the stroke. This may include basic day-to-day tasks such as toileting and getting washed, getting dressed and eating. It may also include more complex activities such as driving, working, looking after children and socialising with friends. Recovery from a stroke is driven by a process called neuroplasticity. Neuroplasticity is the ability of the brain to rewire and organise itself after injury. Recovery is faster in the first 3 months after stroke, but can continue more slowly for a long time. Neuroplasticity is entirely dependent on what someone does. It is driven by experience. If someone doesn't try to practice activities that are difficult, they limit the opportunities for improvement. Find activities that are important to the stroke survivor, something they want to get better at. This needs to be achievable for them to complete. Support the stroke survivor by giving assistance, prompting them or supervising them, making sure everything they need is accessible. Sometimes it might be too difficult for someone to use their affected arm, so allow them to use their non-affected side where they need to, but be mindful to also involve the other arm where possible. Practice is important. Repetition helps the brain to rewire. Practicing in therapy sessions is not enough. Encourage the stroke survivor to participate in activities at every opportunity. Find activities that the stroke survivor can successfully participate in. This will encourage them to become more involved and engaged. Functional independence. Assist, repeat, motivate.